Hello, my name is Alex. I'm a BSM 1 student. This is my patient, Lisa Malberg, and here's her written consent form. And do you verbally consent to be in this video?
Yes.
Okay, and here's my 360 room scan. Here's the floor. Here's the ceiling. Okay, and that's just the consent form. Hello, my name is Alex. I'll be your nurse today. I wash my hands, I close the curtain for privacy, and I'll apply gloves when necessary. Can you please say your name and date of birth?
Lisa Malberg, 5366.
Okay, can I check your MRN number? Okay, I do have the appropriate patient. And today we're going to be doing part 1 of your assessment. Can you please tell me if you have any history of asthma or COPD?
No, I do not.
Okay, and now I'll be assessing your mental status. I'll be assessing your level of consciousness and your orientation to person, place, time, and event. And I do see that you are alert and awake. And for your level of consciousness, because you're focused on me and on my questions. And now for your orientation, I'll be asking you 4 questions. Can you please state your name?
Lisa Malberg.
Can you please state where you are?
At home.
Can you please state what the approximate time is?
6 p.m.
And can you please tell me why you're here today?
I'm here for part 1 of my assessment.
Okay. And you did answer all my questions appropriately and correctly, which you would be alert and awake and oriented times 4. And now I will be assessing your mood and behavior and your appearance. And your appearance, you do look well groomed, and you do are dressed appropriately for the season. And for your mood and behavior, can you please tell me if you're feeling okay, if there's any problems?
No, I feel fine.
Okay, and your mood and behavior are appropriate. You are content and happy and smiling during when I ask you questions. And now I'll be assessing your speech. And when I've been asking you questions, your speech has been clear and articulate. And now I'll be assessing your facial features, such as your ears, eyes, and nose at rest and with movement. And at rest, I do see that your eyes are symmetrical, your nose is at midline, and your ears are symmetrical because they align with your eyes. And now if you could smile for me, if you could frown, you could pop out your cheeks. Okay, and with movement, your facial features are aligned, intact, and symmetrical. And now I am going to be assessing your skin on your face. And it does appear to be a tannish beige color. And your skin does appear intact with no color variations. And now I'll be assessing your eyes, and I will be I'll be observing your sclera and conjunctiva. And if you could pull down your eyelids for me, please. Okay, and I do see that your sclera is white around bilaterally with minimal red veining, and your conjunctiva is clear with no drainage. And now I'll be doing the positions test. If you could just focus your eyes on my pen light as I move it. This will be seeing your eye movements, and just move your eyes and not your head. And I do see that both your eyes were symmetrical and there's no signs of nystagmus. And now I'm going to, with this test and the Perla test, they both assess for cranial nerves 3, 4, and 6. And now I'll be assessing Perla, which is pupils are equal, round, reactive to light, and accommodation. And I'm going to be measuring your pupils. If you could look over my shoulders. And I do see your left eye is around 3 millimeters. Your right eye is around 3 millimeters. and both your pupils were round and equal. And now I'm going to be using direct light to see how reactive your eyes are. And as I shine the light into the left eye constricts. And as I shine the light into the right eye constricts. And now I'll be using indirect light to see how reactive you are to light. And as I shine the light into the left eye, the right eye constricts. And as I shine the light into the right eye, the left eye constricts. And now I'm going to be testing for accommodation. If you look at the tip of my pen light as I move in towards your nose, it is normal if your eyes do cross. Okay, and I did see that both your eyes did converge and your pupils did constrict, which is a sign of accommodation. And your pupils were equal, round, reactive light, and accommodation with indirect and direct light. And now I'll be assessing your lips. I do see that your lips are pink with the right color. There appears to be no signs of dryness, no drainage, no redness. And now I will be assessing your teeth, tongue, throat, and tonsils. We're using my tongue blade. And if you can open wide for me. And I do see that your teeth are white and are intact, and there's no signs of dental work or caries. Do you wear any dentures?
No, I don't.
Okay, and since she doesn't wear any dentures, they are her real teeth. And if you could open up for me, please. I'm going to be looking at your tongue. And your tongue does look pink and moist, no cracking or any drainage or any lesions. And now I'm going to be assessing underneath your tongue. I'm going to see that it is pink and moist and the frenulum is intact. And I'll be inspecting the throat next. Say ah.
Ah.
Okay, and the throat does look pink and moist, no signs of drainage or discharge or exudate, and it does not appear red, any redness. And lastly, do you still have your tonsils?
No, I don't.
Okay, and since she doesn't have her tonsils, I would grade them as a +0. And when I was inspecting there, I did not smell any odors. And when I inspected the buccal mucosa and the hard and soft palate, I did not see any lesions or any drainage. And now I'll be inspecting and palpating the neck to see if there's any swelling or masses. And I do not see any swelling or masses. Is it okay if I palpate?
Yes.
Okay, and as I palpate the trachea, it is intact in the middle, and I do not feel any swelling or masses. And now I'll be observing my patient's positioning or action source and if she's using any accessory muscles. And she is upright and erect and does appear she's using room air to breathe, and does not appear that she's using any accessory muscles to breathe. If she were, some examples would be the trapezius or the intercostal muscles. And now if you could turn for me, please. We're going to be inspecting the posterior thorax, and if you could take off your shirt for me. Okay, turn a little bit more. Okay, and now I'll be inspecting and palpating for the shape and configuration of the spine and chest wall expansion. Is it okay if I palpate?
Yes.
Okay, and as I palpate the spine does appear to be straight in a midline with no signs of curvature. And now I'll palpate for the chest wall expansion. I'll put my hand in a butterfly position, and if you could breathe in deeply. Okay, and as she breathed in, now her chest wall did expand bilaterally and equally about 1 to 2 inches. And now I'm going to be auscultating in 10 to 12 positions, listening to 1 full respiration. I'll be starting at the apex of the lungs, moving in the correct pattern towards the base of the lungs, and then ending mid-axillary. And when I tell you to breathe in and out, could you please? Okay. Can you breathe in and out? In and out. In and out. In and out. Can you move? In and out. 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 Okay. You can turn around for me, please. And I did hear that in all lung fields, all the respirations posteriorly were clear. I did not find any signs of cracking, wheezing, bronchi, diminished sounds. And now I will be auscultating on your anterior thorax in about 10 places. And I will be listening for 1 full respiration. I'll be starting at the apex of the lungs and moving in the correct pattern towards the base of the lungs and ending mid-axillary. You can breathe in and out for me, please.
Okay.
Turn. Breathe in, breathe out. 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 Okay, I did find that in all lung fields anteriorly, they were all clear. And bilaterally, and I found that there's no cracking, wheezing, bronchi, or diminished sounds. And now I will be moving my patient to a supine position, and I'll be assessing their abdomen. I'll be putting a cover or a drape over their chest and lower body. And now I'll be making sure that all 4 quadrants are visible, and they are. And now I'll be assessing all 4 quadrants. I do see that the color is a tannish beige color with pink undertones. And if I go at eye level, I can see that the contour is flat and non-distended. And I do not see any pulsations. And for symmetry, I'll be using the umbilicus for symmetry. The umbilicus is symmetrical for all 4 quadrants. And for lesions, I do see a few small pinpoint primary lesions in form of freckle. They are red and they're flat. I do not see any signs of secondary lesions or any vascular lesions. And now I'll be inspecting the umbilicus. It does look that it is inverted, and no signs of redness, draining, or lesions. And now I will be auscultating in all 4 quadrants. And do you have any abdominal pain?
No, I do not.
Okay, and I will be starting in the right lower quadrant. And if she did have any pain, I'll be ending in the quadrant that had the most pain. And when I auscultate, I will be starting in the right lower quadrant, listening in 2 positions, and then going clockwise. Okay. And I'll be noting any presence of character about all the sounds and frequency. Okay, and I did find that the bowel sounds were about 8 to 10 per minute, which is an active bowel because the normal frequency is about 5 to 30 per minute. And I did hear active bowel sounds in all 4 quadrants. And now I'll be palpating to see if there's any pain or tenderness. Is it okay if I palpate?
Yes.
Okay, and I'll be starting in the right lower quadrant using 2 fingers and rolling them around, going about 1 centimeter deep. And I'll be going in 2 positions in each quadrant. Any pain or tenderness?
No.
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 Okay, she stated there was no pain or tenderness in all 4 quadrants, and her face was not grimacing. There was a negative sign of guarding, and I do not see any distension. And as I palpated, her abdomen was soft. And now I'll be doing the blunt percussion of the kidneys. Okay, and I'll be locating the lower portion of the rib cage, and I'll be placing my hand flat, and I'll be using my other hand as a fist, and I'll be lightly tapping. Any pain or tenderness?
No.
Okay, and I'll be doing the same side. Other side, any pain or tenderness?
No.
Okay, and she stated there's no pain or tenderness when I palpated or when I did the blunt percussion. If you could lay down for me, please. And now I'll position my patient for comfort. I'll put the bed in the lowest position. I will put the call light and the items in reach. I'll put the side rails up ×2, and I'll document my findings.